It's not just what's in your mind, but it's where you live. A new UGA study, finds that neighborhoods lacking basic resources, from safe housing to quality schools, may dramatically raise the risk of serious mental illness. The study found that people in low-resource neighborhoods face nearly 80% higher rates of psychotic disorders. Independent studies show that social deprivation and isolation significantly raise psychosis risk. To that, a 2004 study shows that improving housing, safety, and education access can directly reduce mental health disparities. Let's look into how your zip code can shape your mental health with Sydney James, the lead author of the study and a doctoral candidate at UGA's Franklin College of Arts and Sciences. Welcome to the show, Sydney.
Hi, thank you so much for having me.
Absolutely. First, tell us what led you to explore the link between where someone lives and their mental health.
So in graduate school, I've had several classes that have talked about social determinants of health. So that's the conditions in which people exist that are shaped by macro level forces such as social norms, policies, political systems. And that's been shown to have a huge impact on our health, including mental health. And so recently there's been more research coming out on social determinants of health in psychiatry and related to schizophrenia spectrum disorders. And so I wanted to look more into this area.
The data shows 80% higher rate based on the resources that are around you. What was your reaction to that?
I wouldn't say I was very surprised, given how impactful social determinants of health are on individuals with psychosis, and prior research that has debated whether psychosis is caused by these environments or whether the disorder itself causes individuals to reside in more deprived areas.
So this was a meta-analysis. What does that mean exactly in layman's terms, and how many studies did you pull together?
So a meta-analysis is essentially a numerical synthesis of past research on a subject. And it allows us to draw stronger and more robust conclusions. And we had 19 studies that were across various countries using different neighborhood deprivation indices, although there were commonalities across the indices.
You know, when you have done this research and you're doing this research, you see it as a call to action for communities, and if so, where does that action begin?
Yes, I definitely think that like communities and really this research can inform policies and promote the use of structural interventions in more deprived areas. And so communities can do these structural interventions in order to provide and connect individuals to resources. So some structural interventions may include like community outreach events, housing voucher programs, improved public transit. And when these are used with other treatments, it may help reduce the incidence rates of psychotic disorders and symptom severity.
Sydney, I have 30 seconds left. If there was a message you want our viewers to take away from this study today, what would it be?
I guess that like it takes a village. It's not just an individual, and that like we can all do things to promote health equality and help reduce the risk of psychotic disorders.
All right, Sydney James, thanks so much for joining us. Really appreciate it.
Thank you.
All right, take
Have
care.
a great day.